everyone. My name is Sukanya Sodankar and I am part of Group 2 and my fellow members are Amit, Amisha, Surekha, Limbali and Sia Durbatkar. And the topic we have chosen for our presentation skills ISA is a tribute to COVID heroes. Now, the first case of COVID-19 in India was identified on 27 June 2020 in Kerala and the cases started surging faster than it was expected. The country went into lockdown for almost 70 days. A total of 1 crore 15 lakhs 54,894 infected cases were reported. Around 2,000 people were getting infected daily. This caused an environment for chaos and panic among people. It was a battle between life and death. People were losing their lives every single day. And doctors worked round the clock, keeping a check on the patients and trying to save their lives. And if the doctors were on the front line of the battlefield, the police were holding the fort. They stayed away from their families for weeks in order to protect the nation from this pandemic. The food suppliers, the army, the health and sanitation workers, the policemen and the doctors, these are the courageous people that risk their own lives to save ours. They work 24/7 so that we don't suffer. These are the real heroes. This well-deserved tribute is extended not only to the COVID workers but also people who contributed to keep the society going and all of us safe. Now I'll hand over to Amisha. Thank you.
Thank you, Sukanya. Now I would like to talk upon our brave warriors in the white coat. Since the beginning of the outbreak, our doctors have truly been selfless warriors, doing everything to uphold their job responsibilities, even at the cost of cutting themselves off from their loved ones. Many doctors have experienced the gratification of saving people's life, but many battles have been lost too. The doctors have gone to the extent of even sacrificing their own lives. Doctors have been standing strong with their stethoscope, ventilations and thermometers as the weapon. The lack of definite cure for the infection have made the doctors' work more difficult. Doctors have to stay connected to the patient through phone calls and video calls. Many of the doctors have left their homes and shifted to solitary accommodation where they go and take rest after completing a duty of 15 to 18 hours, which is very difficult. Now, I would like to call upon Surekha for the next part of the presentation. Thank you.
Thank you, Amisha. The list of sleep-deprived heroes include doctors, nurses, ambulance drivers, and healthcare administrators. In the fight against coronavirus, the brave medical army stands strong, with stethoscopes, thermometers, and ventilators as their weapons. The Corona warriors have sacrificed their lives while saving the lives of many people during the pandemic. After independence, nearly 35,000 policemen have laid down their lives for the security of people. But in the past 10 months, the police jawans have sacrificed their lives in line of COVID duty to save the lives of many people. The dedication of cops and other corona warriors deserves a salute. The doctors were kept in quarantine at the end of the day after treating hundreds of people. Their work with the PPE kits on for 12 hours at a stretch is unbelievable. The medical researchers are working day in and night out against all odds, hoping to find an antidote to the disease. Some of them had to postpone their marriage to serve humanity but ended up losing their lives, while others lost their lives before even seeing their newborn child. Thank you, that was all from my part. And now for the next part of the presentation, I would like to call upon Sia.
Thank you, Surekha. And now I am going to share about Dr. Avi Sharma's experience on COVID-19 treatment. He was a doctor and he was working in KEM Hospital of Bombay, and he was currently posted to Kasturba Hospital. When coronavirus was being spread in Mumbai, he was posted from KEM Hospital to Kasturba Hospital, and his family was worried as well. During his working hours, he was given an option to go home because he was working in low infection zone. If If someone is tested positive for COVID-19, the entire treatment is dependent on what kind of symptoms that person has. If that patient's results come positive, but he doesn't face any problem, then he is given a tablet for 5 days. If that person suffers from pneumonia, then an injectable antibiotic is given along with the tablet. If the person is very serious, then he or she is shifted to ICU. The biggest problem for for them was wearing PPE kit and working for long hours. It becomes very difficult during the summer hours to work as a doctor. He feels great. It gives him pleasure that he is able to help the patient and the country. That's all from my side. Now Amit will take over.
Thank you, Sia. Hello everyone, my name is Amit Kumar. I'll be talking about the difference between the doctor's life and the government life in a pandemic situation. The doctor's life in the pandemic situation was too bad. They have to work 10 to 15 hours continuously without getting any break and any holidays in middle. They have to wear a PP protection kit all over the day with a facial mask and using a lot of sanitizer all over the day. They are the forefront on the battle of the coronavirus. In spite of all this, taking the risk and all, they meet personally to the corona patients and they try to motivate them to live their life for happily and so that they can fight with the diseases and all. They have sacrificed a lot of things in the pandemic situations, like their families and their personal life a lot. In spite of this, some of the patients even started spitting on the doctors and firing the bad words on the doctor. But the doctor did not listen to them. They stayed calmly and they did their services very well. The real hero of our country is the really a doctor and the soldiers who were there. The next will, on the other hand, the government, who have the working as 7 to 8 hour working with a lots of conference calls and meetings. But the difference between the doctors and the government are the doctors were working without any ACs and ventilations, but the government were working in well facilities, ACs with fans and a lot of facilities towards them. The tough situation for the government was how to run a country when the GDP was in the negative, as they have to invest a lot of things like a production of PPE kit, making of hand sanitizer, making production of masks and a lot of things.
Thank you, Amit. As we saw, doctors are actually our true heroes. Not all heroes wear capes, but in the midst of this novel coronavirus pandemic, our true heroes wear scrubs. Our home quarantine citizens are expressing their love and gratitude towards the workers, the doctors, the nurses. And why shouldn't they? We as citizens have been clapping hands, banging utensils, lighting diya to salute their bravery. Every doctor, every nurse has a fight much bigger than this pandemic, the fight against their own fears. Yes, they are doctors, they are nurses, but firstly, they are human beings. They too get scared, and overcoming this fear requires mental strength. A medical professional knows exactly how they can catch this virus, the effects of this virus, and the risks associated to the same. Yet, they choose their duty over their fears. And this is why we, Group 2, take this as a special occasion to pay tribute to not just one person but the entire medical team for their selfless service and dedication towards the entire globe. It is because of them that we are alive and breathing today. We would also like to extend a warm thank you towards the medical fraternity for their selfless service. Thank you, and with this we come to an end of our presentation.